Welcome to the Lone Star College Polysomnography Program Information Session. My name is Jordan Rusk. I am the Program Director. This presentation will go over what polysomnography is, what our program looks like here at Lone Star College, and how to apply to the program. So what is polysomnography? We are a healthcare field that most people don't know about or doesn't know that it is a career path and possibility. We are called sleep technologists, and we help doctors diagnose and treat patients with various sleep disorders. So, as a sleep technologist, we apply all of the electrodes for a sleep study, and we also record and monitor the patients throughout the night. During a sleep study, we are looking at as much data as we can from head to toe to determine how well is the patient sleeping, is anything going on with them while they're sleeping, so that it can help the doctor come up with a diagnosis. A sleep study is a non-invasive overnight exam that allows the doctors to monitor you while you're asleep and to see what is going on with your brain and your body. So this is a great healthcare field if you do not like needles or bodily fluids. Everything that we do is surface electrodes. Most patients are done in an outpatient setting. There are a couple instances where there is an inpatient sleep study being done, and that tends to be in our pediatric population or in adults who are really sick and have a higher level of acuity. During a sleep study, we're not only looking at your brain waves to see how is your brain doing when you're sleeping, are you getting the normal amount of sleep stages that you need to be for your age, but we're also looking at how are your eyes moving or not moving? What is your muscle tone when you're asleep? How is your oxygen levels? How is your breathing? Are your legs moving? Are you snoring? What is your heart doing? So again, we're really looking head to toe to see what is going on with the patient. So here's just a little graphic of what it looks like when we have all of the electrodes on. It is a lot, but again, we're trying to get a good understanding of what is going on with the patient while they are sleeping. So at our program here at Lone Star, you will learn how to apply all of those electrodes, how to interpret the data that those electrodes are giving onto the computer, and you'll also be a patient. So you'll be able to see what it feels like to wear all of those electrodes and try to sleep with it on and be able to give feedback to your classmates. So we use something called the International 1020 system to help find the different lobes of the brain to be able to find where the different sleep stages are occurring. So, for example, in your occipital lobe, so at the back of your brain, that is when we can tell when you actually fall asleep. So, we use this measurement system to be able to find that on any patient of any size, to find that lobe of the brain, and that's where we put electrodes on the scalp. And then all of these squiggly lines over here on the right are coming from those electrodes that we put on. And so that helps us determine if the patient is awake or asleep, even if their eyes are closed, because we go off of their brain waves. So all of these squiggly lines you will learn how to read and interpret, and they all mean something. So this is what we are looking at for 6 to 8 hours, depending on the patient, to be able to get really good data and information on how they are sleeping. There are different types of sleep studies, so not every patient needs an overnight in-lab sleep study. Depending on what their symptoms are, some patients may not even need a sleep study. They just need to meet with the physician and come up with maybe a treatment plan, like insomnia, for example. But if someone does need an overnight sleep study, that's something we call a PSG or diagnostic exam, where we put all of the electrodes on them and monitor them. There's also some daytime tests that can be done if they're looking for narcolepsy or idiopathic hypersomnia. So, patients who fall asleep unexpectedly, that is a daytime test that can be done. We also do what's called PAP titrations, positive airway pressure. So, if a patient is diagnosed with some form of sleep disordered breathing and the physician feels that a PAP therapy option is best for them, they will come back to the sleep lab and we put the electrodes on them again. And this time we would apply a PAP mask and put them on the mode of therapy that is recommended for them and actually titrate, so increase the pressure as needed to hopefully eliminate that sleep disordered breathing. And there's also something called a home sleep apnea test. These have become a lot more popular and common, especially in our patients who do not have any other comorbidities or diseases and otherwise healthy and maybe just snore a lot, or it's probably pretty accurate that they're going to have a form of sleep disordered breathing. We don't need to have them in the sleep lab. There is something called a home sleep test. It is less electrodes and it is something that the patient wears at home and they can sleep in their bed at home and then bring the device back to be downloaded and interpreted. So, why is our field important? Sleep is crucial for not only your physical health but also your mental health. So, not getting good quality sleep is going to increase your risk for chronic health conditions like heart disease, high blood pressure, diabetes, stroke, heart attack. All of those really awful things could potentially be avoided if you get good quality sleep early on. It also reduces your quality of life. We all know how it feels to not get good sleep. We don't feel our best. We don't act our best. Our brain doesn't work well. So we really need sleep. That's when our body is able to rest and repair, store all of the things we have learned, store our memories. And if we're not getting that good quality sleep, it starts to affect us in our day-to-day life. Currently, there are over 85 different types of sleep disorders. All of those you will learn about in the program. Not all of them necessarily need treatment. Some, you outgrow, like sleep terrors. Um, some do need treatment. So we are educated in all of those and the different treatment options as well. As a sleep technologist, you will predominantly work at night unless you go into a day role or a supervisor role. But the day person is a little bit different, and I'll talk about that in a minute. But as a night tech, you are responsible for preparing your patient for their sleep study. So you do all of their intake forms, take their vitals, apply all of the electrodes. And then you are also the one that is monitoring and recording all of that sleep data throughout the night. Some places also have the night techs do some of the analyzing of the sleep data. Sometimes that is what the day person does, reads and interprets all of that data and generates a report for the physician then to review. We also educate patients on sleep hygiene and different treatment options, and we're really there to kind of be their cheerleader to let them know that, we know this may not be the most amazing and fun health experience, but we are here to help you and how can we do that and really make sure they understand their diagnosis and the treatment option that we're going to be doing with them. Skills needed. So, as a sleep technologist, really attention to detail. You have all of those electrodes on. You can see this tech in the photo is looking at a screen. That's what's coming across your screen all night. So, you need to have good attention to detail to make sure that you're getting good quality signals throughout the night. Be compassionate. Again, these are patients who are not sleeping well, so they are not always their best because they don't feel great. So being able to be compassionate about that. Having technical proficiency with the equipment. So we will teach you how to troubleshoot the equipment and if something goes wrong, but being technically proficient is helpful, especially since a lot of our stuff has to deal with electrodes and the computers and amplifiers. Also, the ability to work independently and critically think. So, as a sleep tech in the sleep lab at night, there are not doctors, supervisors, anyone like that around. It's usually just your other sleep technologists. So, you need to be able to work well independently and also use your critical thinking to your patient. So the knowledge that you learned, be able to apply it so that you can determine if there is an emergency or a situation that needs intervention, you feel confident that you can do that. Our program here at Lone Star College-Kingwood is brand new to the Lone Star College system. It will be at the Kingwood campus. It is an associate's degree. It is 4 semesters long. We will start a new cohort of students every fall, and we'll be the third college in Texas to offer an associate's degree in polysomnography. Our curriculum includes all of the information that you need to know to be able to sit for your registry exam, as well as be able to go to clinicals and apply everything that you need to know as a sleep technologist. We are a 60 credit program, so that does include your 10 prerequisite courses. It is a full-time curriculum. The classes will be held on campus in person during the day. And starting your second semester, you will begin clinical rotations at area hospitals, and those will predominantly be at night, and they are 12-hour shifts. Starting your third and fourth semesters, there will be 1 day rotation in there for you so that you can see what the role of a day sleep technologist is as well, because it is very different than the night technologist. We do ask that you do have transportation since you will be going to different hospitals, and most of the time you will either be by yourself or with one other student, so you will need transportation to those clinical sites. The coursework will be completed here on campus. We do have a 6-bed sleep lab here on campus that we will utilize for labs. Clinical rotations are off-site, and they will be 1 to 2 hours per week depending on the semester, and they are 12-hour shifts. You will graduate with over 1,000 clinical hours, and you will have clinical rotations in both adult and pediatric patients. When you finish the program, you are eligible to sit for your registry board exam and earn your RPSGT credential. And then we have our starting pay here, and this is for a registered sleep tech in the greater Houston area. This is about the average that we're seeing, and some of those, that pay range could already include that night shift differential. Sometimes, depending on the lab, they add it onto that. It just kind of depends on the hospital. The sleep field is growing. It is expanding. It has really good outcomes, and it's just exploding. But with that comes a shortage of sleep technologists. So that is why we are starting this program here at Lone Stars to really help with the greater Houston area tech shortage and be able to contribute to that. So part of that is there's just a growing demand. Sleep is a more popular topic, and it has been studied to link directly to your physical and mental health. And so there is increased awareness on the importance of getting good quality sleep. We do have an aging population, so that contributes to having some more sleep-related issues and more patients to see in the sleep lab. And there are quite a bit of advancements in treatment options for sleep disorders. Historically, really the only option was CPAP therapy. Now there's different modalities of PAP therapy, there's implantable devices, there's dental devices, and there's so many things being studied right now on other treatment options to help with compliance. So that is very exciting for the field of sleep. As a night sleep technologist, you typically work 3 12-hour shifts per week. As a day sleep technologist, a lot of times they work 5 8-hour shifts. You can go into research, you can become a clinical sleep educator and earn that credential. You can work for a DME company with fitting the mask and doing patient education, and then there's also sales opportunities as well. Our program here is an Associates of Applied Science. It is a selective admission program, so you do need to apply. In order to apply for our program, there are some prerequisite requirements. So there are 3 courses that you need to take: Biology 2404, English 1301, and then just one of the following. You don't have to do all 3. So Psych 2301, or Sociology 1301, or Sociology 1306. There are 2 general education courses built in the curriculum, so if you can take those ahead of time, that is great because that just frees up your time while you're in the program, and that adds some extra points to your application as well. Applicants must be 18 years or older at the time of application, and you do need to apply to be a student at Lone Star College before you can apply to our program. So if you're not already a student at Lone Star, you need to apply and submit all of your official transcripts to the Lone Star system. That will give you a student ID number, and that is what will allow you to register to our program itself. Another application requirement is to take the health science reasoning test. This is a test that just measures your ability to critical think. You don't need to study, you don't need to have any knowledge of sleep to be able to take this exam. It is really just to see how can you critically think during the exam. It does cost $15, and there is a link that you need to pre-register and pay. Once you take the exam, your scores will populate into your application within about 2 business days, so be patient. And scores from previous years will not be accepted. So if you apply to the program this year and you're not accepted and you want to apply again next year, you will have to take that HSRT test again. Our application period is open until June 20th. There is a link to apply on our webpage, or you can go to the Health Occupations application page and then you'll see polysomnography. Please check your Lone Star College email frequently. All communication about the program and your application will be communicated through your Lone Star College email only. Once you have applied, you will be ranked. So we do have a ranking system, and this is on your web application as well, so you can see how many points you get. But it's based off of your prerequisite courses. Have you taken any of those other general ed courses? How did you do on your HSRT? Do you have any previous degrees? The only time points are deducted are if you've taken a class multiple times. So for example, if you've taken English 1301 and you didn't like the grade, so you retook it and got a better grade, we do deduct 1 point for each course that has been attempted more than once. And once the application period closes, the application committee will review and rank the applicants. The top 12 applicants will be contacted to be welcomed into the program. So once you apply, if you are the top 12, and you get an acceptance letter, that is a conditional acceptance based on your background check and drug screen. So you do not need to do your background check and drug screen when you apply. If you are accepted, then we will send you the information regarding that. And then this is again, if you are accepted into the program. After you are accepted, we will begin to ask for different vaccines and a physical and a current CPR. This is so that we can clear you to go to clinical rotations, and these are all listed as clinical affiliation requirements with the different hospitals. So you don't need to turn anything in when you apply to the program. This is only if you are accepted, then these are the things we will ask for. I do ask that if you do not have your hepatitis B vaccine, to please start that if you are very seriously considering applying to the program, since it does take about 6 months to complete if you do the traditional 3-shot series. And so we want to make sure that you can complete that in time to go to clinicals. All right, you made it. So if you have any questions about the program, you are welcome to email me or call my office. If you have questions during the application process or about the application, there is an email here as well and a number for you to call where they can assist you in that as well. Thank you so much for listening to this presentation, and I hope you learned something, and I hope that you apply to our program here at Lone Star College-Kingwood.